Despite constant calls for social distancing since the outbreak of the COVID-19 pandemic, there are still large gatherings, especially at night spots. The issue has now caught the attention of Public Security Minister Kemraj Ramjatan, who said that he is perturbed as to why some sections of society are not taking the virus seriously. Minister Ramjatan noted that while the virus has claimed the lives of thousands globally, Guyana, like most countries, are still putting systems in place to strengthen its healthcare system, which he admitted might not be prepared to handle a worst-case scenario. The minister implored that it is not too late for Guyanese to adopt the necessary lifestyle changes that could eventually save their lives. If there is continued non-adherence to social distancing guidelines, the minister has this plan of action up his sleeves.
And we also have to do some other things else, like lock down certain places. We have given advisories, yet people are not listening to us. There is this cavalier, carefree attitude. We have to ensure then that if it has to be with certain decrees, with penalties behind them, we are going to start doing that.
Chief Medical Officer Dr. Shamdeo Prasad earlier this week said that based on the Health Ministry's own investigation, there are still several persons that are likely to be tested and placed under quarantine. These persons were said to might have been exposed to the virus. Against this backdrop, Minister Ramjatan further noted that apart from the social gatherings at bars and night spots, persons are still congregating in large numbers in public places, which can pose a health risk to other vulnerable groups.
A number of people in Guyana, at the markets, at the bars, at the restaurants, so many other places are still in clusters. Maybe you have one or two or three people who might have the coronavirus. They might survive because they have in their systems the antibodies to prevent them from going even worse. But they could then pass it on to somebody that has vulnerabilities like diabetes, high blood pressure, lung infection, and a number of other things. So we have to make sure that we live the lifestyle change that is being asked of by the Ministry of Health.
The minister added that apart from the pandemic threat to Guyana, government is also dealing with public backlash. He announced that a local COVID-19 task force in the coming days will be implementing more lockdown measures.
We had a meeting with the task force on COVID-19, and that task force is now making some serious decisions. We have to input it from all across the various ministries and government departments and all of that. And so we are going to start doing a number of things. You probably heard that we have already closed the airport for a 14-day period, locked down as it were. Yes. We are following the pattern of Trinidad and some other CARICOM countries and even America.
Javone Vickerie, HGP Nightly News.